Hi, I'm Dr. Lisa Gibbs. I'm the Chief of the Division of Geriatric Medicine in the Department of Family Medicine here at UC Irvine. Today I'm here to talk about elder and dependent adult abuse. This podcast is being supported by the Health Resources and Services Administration of the United States Department of Health and Human Services, which currently supports a grant that we have called Cultivating a Culture of Caring for Older Adults to improve the care of older adults in Orange County. Let's start by talking about the types of elder and dependent adult abuse. I will briefly review each type of abuse and discuss how it is different in older adults. Starting with physical abuse, this is really what you might imagine it to be: punching, hitting, kicking, but in older adults also medication administration, improperly done, and restraints, for instance. Self-neglect is a different type of abuse that we also consider, even though it is one's inability to care for oneself and does not involve another. Neglect is the most common type of abuse, and this involves a caregiver who is not supplying or not supporting a victim with the basics in terms of nutrition, housing, medication, health needs, and so forth. Sexual abuse does exist in older adults. Some believe it happens more often in facilities such as nursing homes, board and care homes, assisted living facilities, but it also can happen in persons' homes as well. Emotional abuse is mostly verbal abuse, but it comprises basically of the lack of dignity and respect that an older adult or any person really deserves. And financial abuse is rampant. Really, it is really occurring inside the home or inside one's own family with regards to house mortgages, deeds, trusts, etc. But also outside the home, there's much fraudulent activity in terms of lotteries, bad contracts, or anyone willing to fraudulently obtain someone's money. Let's talk for a minute about the incidence of elder abuse and the types. This is from an old study from 1998, but even so, it gives us an idea about the numbers that we may expect. Neglect is the most common type of elder abuse, around 50%. Emotional is next. Physical abuse occurs around 30%. Financial abuse in this particular study was 26%. However, if we take into account all of the financial abuse that occurs, this could be much, much higher. Older adults are abandoned about 4% of the time, and sexual abuse is thought to be the least amount of incidents at 1%. Okay. What's really important to know is that elder abuse is underreported. So for every report of abuse that we know about, one study showed that there are 23.5 cases that we do not know about. And what this means to us is that elder abuse is really happening everywhere. Again, 1 out of 10 at least, 2 out of 20. If you know 20 older adults, you know someone who has been the victim of elder abuse. It wouldn't be proper to talk about elder abuse without mentioning ageism. Ageism exists in our society and really colors the way that we think about older adults. Acknowledgement of abuse often requires challenging these perceptions. Ageism equates age with poor health and creates an inattention towards older adults' health priorities and priorities in general. Sometimes we can get caught up in the moral and ethical dilemmas of elder abuse. But in general, first we need to be aware of it and we need to be able to see it. Sometimes it is really helpful to step back and just ask yourself, is it okay that someone's living this way? Is it okay that somebody died this way? This is a quote from someone in the older adult field, basically an administrator of a nursing home, talking about an incident that occurred. He said, "All he did was lift her nightgown and rub her breasts. Nobody got hurt." And I present this as an example of ageism because if this had happened to a younger woman or even a teenager, I think the response would be much, much different. As medical professionals, we also need to keep in mind that there are many negative consequences of elder abuse. In general, the mortality rate is 3 times greater in an older adult who's experienced abuse than others in their age group. In addition, older adults experiencing elder abuse are twice as likely to be hospitalized than other seniors, are 4 times more likely than non-abused seniors to go into nursing homes. And regarding financial abuse, they can be exploited to the extent that they turn to Medicaid as a result of their losses. And these are folks that have saved their entire lives, that have pensions, that have homes, but have been robbed of all of those assets to the point where they qualify for Medicaid. In terms of culture, there are some cultural differences and some differences in ethnicities and how they report elder abuse. The 2 pie graphs that you see are from Orange County and basically indicate the types of reports that have been made to Adult Protective Services by ethnic group. So if you look at the first pie graph, this is actually a graph of the population in Orange County around year 2000. And you can see that they're about 50% Caucasian. The next largest group is Hispanic, and followed by Asian. And then a smaller segment of the population, we have African American. If you look at the bottom graph, this denotes the percentages of reports to APS. And you'll note that the graphs are different. So even though the Caucasian population makes up 50% of our county, there are more than 50% of reports, while the reports for the other groups are much less than their denoted percentage in the population. So clearly something is going on here that needs to be further studied. So who abuses older adults? Well, it turns out, unfortunately, that over 80% of the time, the abusers are relatives. This is probably not the type of society you think we're living in, but this is unfortunately borne out to be true study after study. This pie graph shows that in about 50% of the cases, it's the children that are abusing their parents. We also have siblings, grandchildren, and spouses. If you look at the non-relatives, they make up a minority of this pie graph and include friends and neighbors, in-home service providers, and people outside the home. Oftentimes as well, dependent children that live at home, dependent on their parents, who may be involved in drugs and alcohol or have mental illness, comprise a majority of these children that end up abusing their parents. We see multiple medical implications from elder abuse, and there are many, many things to be aware of. For those with dementia, over half will experience abuse in their lifetime. We need to be aware of the physical signs of abuse, including bruising, pressure sores, fractures, burns. There are ways to understand whether bruising comes from an accidental fall or an accidental brush or bump against the furniture versus a bruise that was obtained in a traumatic way. Pressure sores are unfortunately common in folks that don't move and are immobile. However, there are ways to care for patients so that pressure sores can be a more rare occurrence. And we can understand which caregivers are truly caring in the proper way and which caregivers are not. Depression is both a risk factor and a consequence of elder abuse. And again, functional status is both a risk factor and a consequence. In terms of mandated reporting, every healthcare provider is a mandated reporter. If the abuse is thought to occur in a community setting, i.e. a person's home, then the report must be made to Adult Protective Services. If a person is living in a residential facility, a nursing home, a board and care home, then the report is made to the ombudsman. And in many, many cases, these reports also may go to local law enforcement, especially if they reach a criminal nature. And that includes many financial fraud cases and many physical abuse cases, as well as neglect and others. The types of reports that must be made include if a health professional sees a physical finding, which is thought to be the result of abuse. If there's a suspicion that the abuse is occurring, sometimes a person may be in your presence but will not answer your questions directly and instead defer to someone else as if they were afraid. Or if you get a direct report from a victim, it's not our burden to confirm the abuse, but it is our responsibility to report if we have suspicion of an event. And this will lead to increased safety and potentially a life without abuse for your patient and potential victim. If you have any further questions, we have a Center of Excellence on Elder Abuse and Neglect here at UC Irvine. And if you contact us, we'll be happy to answer your questions. Thank you.